Welcome to Vital Health Guide, your trusted source for medical insights. Today, we explore Amlodipine Works, a highly popular blood pressure medication. High blood pressure is a silent condition affecting millions worldwide, significantly increasing the risk of heart attacks and severe strokes daily. To combat this dangerous condition, doctors frequently prescribe amlodipine, a highly effective daily medication designed to safely lower your blood pressure. Have you ever wondered what exactly happens inside your body when you swallow that small daily pill of amlodipine every morning? Let us dive deep into the fascinating microscopic world of your circulatory system to uncover the true science behind this medication. Amlodipine belongs to a specific class of powerful medications known globally by medical professionals as calcium channel blockers for blood vessels. To understand how this works, we must first look closely at the smooth muscle cells lining the walls of your arteries. Under normal circumstances, calcium particles constantly enter these muscle cells, causing your blood vessels to squeeze tightly and raise blood pressure. When your blood vessels constrict too much, your heart must work significantly harder to pump blood throughout your entire circulatory system. This constant high pressure damages the delicate inner lining of your arteries over time, leading to severe long-term cardiovascular complications. Amlodipine acts like a microscopic shield, effectively blocking those tiny calcium particles from entering the smooth muscle cells of your arteries. Without the influx of calcium, the muscle cells in your blood vessel walls finally begin to relax and slowly open up. As the blood vessels naturally widen and expand, the internal pressure drops significantly, allowing blood to flow much more smoothly everywhere. This crucial relaxation process directly reduces the heavy workload on your heart, protecting your vital organs from dangerous high-pressure damage. It is truly remarkable how blocking a single mineral pathway can create such a profound healing effect on your entire body. Doctor emphasizes that this mechanism is incredibly reliable, making amlodipine a top choice for doctors treating chronic hypertension worldwide today. The beauty of this medication lies in its targeted approach, specifically focusing on the vascular smooth muscle rather than heart muscle. Because it mainly targets blood vessels, it gently lowers your blood pressure without drastically altering your natural resting heart rate rhythm. Millions of patients rely on this exact biological mechanism every single day to maintain a healthy, active, and long-lasting life. Now that we understand exactly how it works, you might be wondering how quickly you will see results from this medication. When you take your very first dose, the medication actually begins working inside your body within the first 24 hours. You might notice a slight drop in your blood pressure readings during those initial 48 hours of starting the treatment. However, it is extremely important to remember that this drug does not reach its maximum effectiveness immediately after the first pill. Your body actually needs about 7 to 8 full days of consistent daily dosing to achieve the maximum blood pressure reduction. This gradual buildup is actually a very good thing, as it prevents your blood pressure from dropping too rapidly and dangerously. A sudden drop in pressure could make you feel extremely dizzy or faint, so this slow, steady process protects your brain. Therefore, patience is absolutely essential when you are first starting out on this particular medication journey with your trusted healthcare provider. Do not stop taking the pill just because your numbers are not perfectly normal after only 2 or 3 days of use. Consistency is the absolute key to success. You must take it at the same time every single day for optimal results. Once the drug reaches a steady state in your bloodstream, it provides smooth, continuous 24-hour protection against high pressure. Like all powerful medications, amlodipine does come with some potential side effects that you should definitely be aware of right now. The most common side effect reported by patients is a noticeable swelling around the ankles and the lower parts of legs. Statistical data shows that this particular symptom affects approximately 5 to 10% of all people who regularly take this medication. This swelling is not caused by heart failure, but rather by the way the medication specifically dilates your tiny blood vessels. As the small arteries relax and open up, the increased pressure inside the tiny capillaries pushes clear fluid into surrounding tissues. Gravity naturally pulls this excess leaked fluid downwards, which is exactly why you usually notice the swelling accumulating around your ankles. If you experience this annoying ankle swelling, elevating your legs while sitting or resting can help reduce the uncomfortable fluid buildup. Some patients find relief by wearing special compression socks, which gently squeeze the lower legs to prevent excess fluid from pooling. However, if the swelling becomes painful or severe, you must consult your doctor immediately to discuss adjusting your current medication dosage. Your physician might decide to lower the dose or combine it with another medication to effectively manage this specific side effect. And another set of side effects you might experience includes sudden facial flushing, feeling uncomfortably warm, or developing a mild throbbing headache. These particular symptoms happen because the blood vessels in your head and neck are suddenly expanding and carrying much more blood. The sudden rush of warm blood to your face creates that classic flushed appearance that some patients notice in the mirror. Fortunately, these annoying headaches and warm flushing sensations are usually temporary and tend to happen only during the first few weeks. As your body gradually adapts to the newly lowered blood pressure environment, these specific side effects almost always fade away completely. Over-the-counter pain relievers can generally help manage the mild headaches while your body gets used to the daily medication. Always remember to stay well hydrated and get plenty of rest during those crucial first few weeks of starting your treatment. If the headaches persist for months or become unbearably painful, it is time to schedule another quick visit with your doctor. Now, let us talk about a very important positive aspect of amlodipine compared to other common blood pressure drugs available today. Many patients who take ACE inhibitors, like ramipril, often complain about developing a persistent, annoying dry cough that never goes away. This frustrating dry cough is a notorious side effect of ACE inhibitors, forcing many unhappy patients to seek alternative treatment options. The great news is that amlodipine operates through a completely different biological pathway and absolutely does not cause this dry cough. This makes it an excellent, comfortable alternative for individuals who simply cannot tolerate the harsh coughing associated with those other medications. While medications are incredibly helpful, Dr. Alex strongly emphasizes that pills alone only manage the symptoms without fixing the root cause. To truly conquer high blood pressure and reclaim your health, you must actively embrace positive lifestyle changes and better dietary habits. This is where the highly acclaimed DASH diet comes into play, serving as a powerful natural weapon against dangerous cardiovascular disease. DASH stands for Dietary Approaches to Stop Hypertension, and it is scientifically proven to naturally lower your resting blood pressure levels. This incredible diet focuses heavily on consuming abundant amounts of fresh vegetables, vibrant fruits, and healthy, fiber-rich whole grain foods. It strictly limits the intake of the heavily processed foods, refined sugary treats, and most importantly, excessive amounts of dietary table salt. By drastically reducing your daily sodium intake, your kidneys can effectively flush out excess water, unnaturally lowering the pressure inside vessels. The vibrant fruits and fresh vegetables provide essential minerals like potassium and magnesium, which actively help your stiff blood vessels relax. Studies show that strictly following the DASH diet can reduce your blood pressure just as effectively as one starting medication dose. Imagine the incredible healing power of combining this nutrient-dense diet with your daily medication for maximum cardiovascular protection and longevity. Regular physical exercise, such as brisk walking or light jogging, also plays a monumental role in keeping your heart muscle strong. Managing your daily stress levels through deep breathing exercises or meditation can prevent sudden, dangerous spikes in your resting blood pressure. And quitting smoking and limiting your alcohol consumption are two of the most critical steps you can take for your heart health. Remember, true healing requires a comprehensive approach. You cannot simply eat poorly and expect a single pill to fix everything magically. Your daily habits and your prescribed medications must work together in perfect harmony to build a strong, resilient, and healthy body. Before we conclude, there is one absolutely crucial warning about a specific fruit you must know if you take this medication. You need to be extremely careful with grapefruit and fresh grapefruit juice while actively taking amlodipine for your high blood pressure. Grapefruit contains unique chemical compounds that block the specific enzymes in your liver, responsible for breaking down this exact blood medication. This interaction causes the drug concentration in your blood to increase dangerously, potentially leading to severe drops in your blood pressure. Always consult your dedicated healthcare provider before consuming grapefruit or any new supplements to ensure they are completely safe for you. Understanding your medication empowers you to make smarter, healthier choices every single day for a much brighter and longer medical future. Thank you for watching Vital Health Guide today. Please subscribe for more medical insights, and always remember to prioritize your health.